amoxicillin and midazolam work very well together. He still seemed to be like highly anxious, so we gave him dexdermatorb, and this was all given IM. So we just injected him from the back while he was still in the carrier, and then had gotten the TPR and put EEG leads on him to make sure that his heart was okay. And we also monitored his blood pressure with the blood pressure cuff, lubed his eyes, and the technician got the enema from the pharmacy. We attached a red rubber catheter to it, and then she put lube on the catheter and started to insert it. We also drew blood, and the results came back to be normal. And then the doctor did a cysto where she injected a syringe into its bladder, and we'll be sending that out for a urinalysis. The assistant gave the sub-Q fluids since he was dehydrated, and she also cut the nails. His blood pressure was 178/138, with the MAP being 151. The technician explained to me that these were normal because of the drugs that were given, and since he was already stressed out. His heart was also brachicardic due to the drugs. He did not end up being blocked, and we gave the whole entire enema. The technician explained to me that after you're giving the enema, you should slowly back the catheter out. So he was doing well under the sedation, and we did everything that we possibly needed to do with him. The technician also explained to me that we're not going to really be able to recover him as well as we would with any other patient, since he is so fractious, because it could put us in danger. So we then gave his antecedent IM, and once we injected him, we put him back in his carrier. And then he was left on the treatment table with the technician still looking at him to see if he was alert. Once he gave the IM injection, we put him up sternal so he wouldn't throw up, and then put his head up on wee-wee pads so his head was propped up. But then the technician noticed that he was starting to regurgitate, so we took him out of the carrier. He regurgitated a little bit, and the doctor was giving him suction. And then she gave him an injection of Zofran, which prevents vomiting too. He did have Cerenia, but Zofran works a little bit better. So then he began to empty his stool from the enema, and we watched him recover for a little bit longer in his carrier, and he seemed to be fine, bright, alert, responsive, was back to growling, and after a few hours, he was just discharged and sent home. So the technician would go over the discharge instructions with the owner over the phone, and then I helped return the patient back to the owner. If she had any questions, I could reread the discharge paper, go over the medication, or of course, I would tell the technician the questions that they had. Here is my glossary, the words and medications that I have learned from working at this animal hospital the past few weeks. Most of it was from the procedure and the type of drugs that we used with the French Bulldog. So the first one, we have abomorphine, which is a dopamine receptor and a derivative of the narcotic drug of morphine. The primary function is to induce vomiting. So we had an 8-month lab who came in due to ingesting a winter glove. I injected this IV, and then later on, well, not later on, it was actually really fast acting. The dog began to vomit up the whole entire winter glove. Then the next one is Cerenia, which is an antiemetic used to treat vomiting and motion sickness in dogs and cats. So I also injected this to the 8-month lab IV after we induced the vomiting to stop the vomiting. The next one is emesis, which is a medical term for vomiting. So the act of having your stomach contents exit out of the mouth. And this term was written on the board because of the 8-month lab. And then we have encephalitis, which is an inflammation of the active tissues of the brain caused by an infection or an autoimmune response. The inflammation causes the brain to swell, which can lead to headaches, stiff neck, sensitivity to light, mental confusion, and seizures. This was also presented in a French bulldog after it came in for acting off, and the doctors figured that it needed to see a neurologist due to having encephalitis. And then we have flumazenil. Sorry, I've had a little bit of trouble pronouncing these words. I also haven't taken pharmacology yet, but I've definitely learned a lot in this externship with the type of medications and drugs that they mostly use. So this is a specific benzodiazepine antagonist, and it's useful in reversing the sedation and respiratory depression that often occurs when benzodiazepines are administered to patients undergoing anesthesia or when patients have taken an overdose. So we injected this into the French bulldog, which was my first case study after it was after it went under anesthesia, because it was showing signs of dysphoria, so it helped calm it down. And then we have metoclopramide, which increases movements or contractions of the stomach and intestines, relieves nausea, vomiting, and heartburn. This is also light sensitive, so it needs to be kept in a specific bottle from preventing light. I gave this to a dog's fluid bag because the dog was presented with GI issues. And then we have methadone, which is a synthetic opioid that has morphine-like properties, and it is frequently used for the treatment of severe acute pain in small animals. So this was given to the dog during the procedure to help the pain management, also to reduce reflux. And then we have midazolam, which I also talked about, which is the benzodiazepine. This is the sedation that we gave to the French bulldog. It provides sedation and muscle relaxation. And so this is the drug that we use. And then the flumazenil is the opposite acting. Then we have P-Lite fluids, which are sterile isotonic IV crystalloid solution used in clinical medicine to provide water, electrolytes, and calories to patients. So this is mostly what the veterinarians give at the hospital during, and we had this administered during the drain procedure for the French bulldog. I also learned about the different types of fluids and the difference between the crystalloids. And then we have the term pneumothorax, which is the abnormal accumulation of air outside the lungs, but inside the chest wall. The presence of air between the lungs and chest wall prevent the lungs from inflating normally and can lead to lung collapse. So there was a concern that this dog might have this, and it actually ended up being presented on x-rays of a dog that got hit by a car. So the dog was presented outside externally with just a few wounds, but then once we got x-rays, we were able to see that. And then the medication propofol, which is an intravenous sedative for use of the induction and maintenance of anesthesia, which I talked about, which is a great way to put animals under anesthesia when you're not giving too much medication, because if you do give too much, then it can cause sleep apnea. So we gave this to the dog, the French bulldog, during its procedure. And then we have the medication Rimadyl, which is a relief of pain and inflammation with osteoarthritis and for the control of post-operative pain. So we gave this to a dog after it had had surgery. And then we have Unison, which is an antibacterial medication given by injection or by mouth and used on or off label to treat certain infections. So we gave this through a syringe pump, so it could be given slowly through 10 to 15 minutes to the French bulldog during the procedure of the drain just to prevent infection. And lastly, we have Zofran, which I also talked about. It is an antiemetic used to treat severe nausea and vomiting in dogs and cats. So we also gave this to a dog after we induced vomiting, but it was also given to the cat since he regurgitated. So my overall experience at Cornell University veterinary specialist was absolutely amazing. It was a little bit of overwhelming since I'm new to this area of emergency. I have experience as an assistant, but for 4 years, but mostly worked in general practice. And being an assistant is a lot different than being a technician. I got to see a lot of extreme emergency cases that I was able to help out with. I learned, how CPR is used, which I plan on taking a CPR class because I've never actually performed CPR. I learned, when a stat comes in, what to do, um, and just how important it is to handle the animals as they're in critical care. It's not just some patient that's coming in for a vaccine. You have to make sure you really know what you're doing. The staff here was very wonderful, and they were so intrigued to teach me new skills, even the veterinarians that I worked with. Even though it was very busy and I did manage to get COVID, they were able to, work with me and help me complete all of my 121 hours. And I really hope that I can return again sometime. The staff treats their patients wonderful. And overall, it was just really fun to be at.